Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. Now, today's topic is switching drug plans during the annual enrollment period. Drug plans are a very important part of our healthcare coverage, especially if we're taking a lot of meds or maybe expensive meds or even both. And so being on the right drug plan and staying on the right drug plan year to year is very, very critical. Now, I want to remind you, as you enrolled into Medicare, you made a choice whether you were going to go with an Advantage plan or a supplemental plan. If you chose to go with an Advantage plan, notice your prescription drug plan is included. We call that an embedded plan. It's part of the package. So that Advantage plan covers your inpatient, outpatient, as well as prescription drugs. If you chose to stay in original Medicare A and B as the first payer, then you have a supplemental plan as the second payer, and then your drug coverage is totally separate. It's not part of your A and B, and it's not part of your supplemental plan. It's a separate, or what we call a standalone drug plan. And so if we need to switch drug plans, whether it's included or it's separate, then we have the annual enrollment period to do that. So here's the process that happens every year. Number one, you're going to receive right around the 1st of October, certainly before October 15th, but right around the 1st of October, the company who has you covered right now is going to send you what we call an ANOC, or an annual notice of change. And so they're required by law to let you know what your plan is going to look like the following year. And so they'll say, here's what you have with us this year, and here's what we're going to be changing going into the next year. And so my most important piece of advice to you is open the ANOC. Open it up and see what they're doing. There's so many people that assume because they like the plan this year, they're going to like it next year. Do not make that assumption, because the plan has the right to change anything they want. And they may make some change to the plan that could adversely affect you. All right, so here's what we're looking for in the ANOC. Number one, have they changed my premium? Now, frankly, most plans will change the premium. Sometimes it goes up a few dollars, sometimes even down a few dollars. Medicare sets the profit margins for these carriers, and sometimes they actually have to lower their premium. But look to see what the premium change is going to be. This past year, we had one plan that actually raised their premium 150%. And so if someone didn't open their ANOC, their annual notice of change, and was not paying attention to the premium, what happened was when they got their premium bill in January, then they realized, oh, it went up 150%, and now they want to switch, but it was too late. And so open the packet, see what the premium is going to be for the following year. The second thing they can do is they can change their formulary. They can add medications, they can drop medications. So you want to be sure that your medications are covered. All right, they have the right to make those changes. And so open it up and find out if my meds are covered. Now, thirdly, what they can do is they can re-tier or make tiering changes to a medication. All the plans will disclose the covered medications, and with those covered meds, there will be a tiering number, 1, 2, 3, 4, or 5. The lower the tier, the lower the copay. But the plans have the right from year to year to change the tier. And so you may be on a medication this year that's tier 2, and next year they bump it to tier 4. Or maybe it's a tier 3 this year and it's bumped to a tier 5. I have seen tiering switches. When they switch those tiers, I've seen those move medication copays literally $150 to $175 a month. And that means the same medication that you're on from one year to the next could go up in cost of $2,000 to you. All right? And so again, open the packet to make sure you know if there's been any tiering changes that are going to hurt you. Now, if you look these over and there's no changes that are hurting you and you're still happy with the plan, you don't have to do a thing, because that plan, when you do nothing, will automatically renew into the next year. We just want to make sure if it auto-renews, it auto-renewed because you wanted it to, not because you didn't open your ANOC, all right? And so if you're happy with the plan, you can keep the plan. Nothing at all is required of you. But if you're unhappy with the plan and they've made some kind of a change, then here's the process. Beginning October the 15th all the way through December 7th, what you need to do is you need to go to this website, medicareschool.com/AEP, the annual enrollment period. You could also do the same thing at medicare.gov. Both companies, whether it's medicareschool.com or medicare.gov, use the same company to manage the websites. Now, this is one that we have that is our website, and we can help you if you need our assistance. If you go to medicare.gov, of course, you'll be on your own. But this particular site, they both are very similar. If you go to this site here, what you're going to have to do is you're going to have to set up an account, and they're going to ask you just some basic information, your name and your address and your date of birth and your Medicare number. And once you've set that account up, then what you do is make sure you have your medications in there. If your account has already been set up, then you just put your username and password in, because it's all saved from year to year. And then you can update your medications. And that means that if the doctor has changed dosage or maybe frequency, then you need to update. Maybe a doctor doctor has dropped a medication or you've added one throughout the year, then you want to be sure your medication list is up to date, and then you can choose your pharmacy. If you're happy with the pharmacy that you're on now, you'll just have to confirm pharmacy. But if you would like to switch pharmacies, then this is when you need to do that as well. And after you've loaded that information in, now you're going to shop. You're going to compare plans. And what the software is going to do is going to look at all the plans in your particular zip code based upon your medications and the pharmacy you want to go to. And it's going to shop them all. It's going to look at all the plans in that market, and then it's going to take those and it's going to put them in order from top to bottom, looking at coverage and costs. So it's going to show you if your meds are covered and what the cost of your co-pays and the cost of the premiums will be. It'll put all of them in order. And so we recommend people definitely enroll in something that's at the top, or at least the top 3. Now sometimes the top 3 plans may only be a few dollars apart. So let's say this year I'm on a plan that next year is showing it's the number 3, but there's just a few dollars difference. You probably just want to stick with the plan, because if you enroll into a new plan, you may have to change pharmacies and your doctor is going to have to resend the meds. But if there's a drastic difference in price, then we feel like it's well worth your time to switch plans, even if the doctor has to resend the medications and you have to change pharmacies. All right, so that's the process that's involved if you need to switch your drug plan during the annual enrollment period. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.